Can clinical tools really confirm a schizophrenia diagnosis? Imagine trying to solve a complex puzzle where some pieces look similar but fit in very different places. That's what diagnosing schizophrenia can feel like. It's a tricky condition that affects how someone thinks, feels, and behaves. So, can a few clinical tools really give us a clear answer? Let's find out. Clinical assessment tools are like checklists or scales that help doctors understand a person's symptoms better. They include instruments like the Positive and Negative Syndrome Scale, which measures how severe hallucinations or delusions are. There's also the Brief Psychiatric Rating Scale, used to track overall symptoms over time. These tools help organize what the patient reports and what the clinician observes. But here's the key point. These tools are not designed to give a yes or no answer on their own. They are like guides that help clinicians see patterns and severity of symptoms. For example, if someone reports hearing voices and shows disorganized speech, these tools can help measure how intense those symptoms are. They also help track changes over time, which is useful for treatment. However, the diagnosis of schizophrenia depends on more than just scores. A trained mental health professional considers the person's full history, their environment, and how symptoms fit together. These tools support the process but do not replace the clinician's judgment. They cannot definitively say, this person has schizophrenia, because many other conditions can have similar symptoms. Conditions like bipolar disorder with psychotic features or severe depression can look very similar. That's why a thorough clinical interview is essential. The professional asks about the person's thoughts, feelings, and behaviors, and considers how long symptoms have lasted and how they impact daily life. In recent times, new methods like mobile health systems and artificial intelligence are being tested. These might analyze patterns in speech or blood tests to help identify schizophrenia earlier. But these are still in the research phase and are not yet standard tools for diagnosis. So, to answer the question directly, clinical assessment tools are helpful for understanding and measuring symptoms, but they cannot confirm a schizophrenia diagnosis by themselves. The final diagnosis depends on a careful, comprehensive evaluation by a qualified mental health expert. They combine the information from these tools with their clinical judgment to arrive at the most accurate conclusion.